Welcome to Finding Certainty with your host and U.S. Army veteran, Patrick Laing. Over the next hour, you'll learn from Patrick and his expert guests how to attract more certainty into your business and your life. Now, here is your host, Patrick Laing.
Welcome to Finding Certainty. It is a beautiful Friday morning here in Henderson, Nevada, and I'm very excited about our guest today, Mr. Rob Hagen. Rob, thanks for being with us here on Finding Certainty.
Absolutely excited to be here as well. Thank you.
On our show here, as you know, we unpack and we dissect, we kind of peel away the layers of the artichoke of this topic of certainty. And it's interesting because we did a Google search once and there were tens of thousands of hits for the word certainty. We also Googled the word uncertainty and there were hundreds of thousands of hits, which is something about how much worry and concern and fear and trepidation is out there. That's one of the reasons I started this show, to try to help offset that. But I'm excited about having you on the show because what you do and what you're offering, I think, does more to address this concern for employers than just about anything else we've talked about, anything else we see in business. Certainly as much, if not more, than a lot of what's out there. So very excited to get into it with you today and to have you on the show. So I always start out the show by introducing my guests in a specific way. I like to share a couple of reasons why I've asked this guest to be here. And the first is what I was just referring to, the fact that Rob, with his company, CrossFire IQ, and their program called Vital 110, is addressing this need for businesses with for-profits, nonprofits, et cetera. But it's helping them address this uncertainty question. They're helping create a number of free benefits for employees. Employers actually get rewarded for offering it and so forth. So I'm excited to dig into that and peel back the layers, as I said, of how it works. This second reason, though, I wanted to ask Rob, besides the fact that we're very good friends, we go back a ways, and he's one of my favorite people in the world, but he is a consummate business expert. He's a former CEO. He's been on the board of multiple Fortune 500, is my understanding, as a board member, Rob. He's taken over 100. He's spearheaded over 100 merger and acquisitions around the world. I think it's 130 or thereabouts. You can give me the exact number, but we're talking to one of the sharpest financial minds I've ever met, and that's a piece of this Vital 110 initiative. Let's call it the financial piece for the employer and for their organization is a very big impetus, a very big value add to this extraordinary offering that they've created. So let's get into it, Rob.
Awesome.
As I was saying earlier, we always start out with getting to know you a little bit. Let's go back in time. I gave them a quick snapshot about your background as a CFO and as a financial expert and so forth. But tell us where you grew up and where did Rob Hagen get his start?
Where did I get founded?
Yeah.
So I grew up in Southern California. Was born in Pasadena. Spent a lot of time living in Palos Verdes, and went to high school in La Cañada, which is where my wife went as well. And went to undergrad school at San Luis Obispo, one of the most beautiful places. Great college. If any of you guys have kids looking to go to college, it's that great mix between, professors are not ideologists. They are not, they're not torn to ideas. They're torn to, they've had 30, 40-year careers in business. They're business leaders, and they want to spend their later lives giving back. And to have a public university, when I went, it was $231 a quarter was the tuition. I can tell you, from having 6 kids and 4 in college, it's not $231 anymore.
No,
but
it's not.
There are some just, I can't say enough good things about Cal Poly. Graduated from Cal Poly, went to KPMG, one of the top four accounting firms in the country, and that's where I was part of the M&A team. I did about 70 M&A transactions and about and IPOs, initial public offerings, when I was at KPMG, and really it was a great way to train. Wasn't for me for long term, but it's really where I got my start.
It's interesting how we launch our careers and we really don't know where they're going to take us. We might have an idea, we might have a passion, but we just set out, right? We set out into the dark, as it were. And the exactly opportunity right. to work for KPMG, that's one of the big four, Price Waterhouse, and others. I can't imagine that you didn't have extraordinary mentors and challenging projects and worked with some very large companies. And you can't help but learn in the process. You're in the trenches, right? Every day. What was that like?
Yeah, it was fascinating. One of the neatest things was, if my clients were going through a major change, you ever want to figure out what's really going on inside a business, and they're going through an initial public offering, going from a privately held organization to a publicly held organization. And the role of the finance organization is not just limited to keeping the books, but it's now expanded into investor relations and dealing with hedge funds and all the folks that are big investors and individual investors. Huge change process, tons of stress. You get to meet people for who they are. And your job is really not necessarily to figure out how to audit them and help them get onto the public exchange or be a part of a bigger business, but it's really about change management and change. I don't think change management is just what you do to help the process of making sure the change goes well. It's change leadership. How do you think differently about wealth creation, as well as understanding who is your core customer and how do we treat our employees? I love that part of the process. I had a tremendous mentor. His name was Tom Evan. He was in charge of the middle market practice in the Bay Area. I was up in the San Francisco, San Jose. I was up in Palo Alto. And Tom won. He let me play basketball. I was 24, 25, 26. Let me play basketball with all the partners at KPMG. So I got to know some really neat people through that mentoring process. Played basketball relatively poorly, but had a great time. And but it's the people you meet. Life is about the people you meet and figuring out how you can help them so that when you need it, they're there to help you.
I completely agree. I think as you start having those experiences and gaining mentors and gaining insights and so forth, invariably you start growing wiser and wiser, right? I just turned 55 about a week ago on February 25th. And I was talking to my wife about this the other night, just about how, whether it's just the going through the lumps and the experiences and losses and triumphs and everything, you just start seeing life differently. You start seeing business differently, relationships. It's a combination of the books you read and the people you know and the experiences you have.
That's right.
We talk about finding certainty. Well, it doesn't happen overnight, right? We don't become wise or even insightful overnight. We look at our kids and we're like, wow, they're so stupid. Well, they haven't had a lot of experience yet, right? But I love that. I love the fact that you, as you talk about how a company is changing and evolving, it's easy to think the bigger we get, the easier it's going to get, right? We're going to have more money and we can hire more people, but you start getting into more responsibility and more regulation and compliance and more liability and, et cetera, et cetera. There's a definite balancing act to it. And you talk about leadership. Are you familiar with Vistage Worldwide by chance, or maybe the Bohr community, some of those? I was a part of Vistage for a long time, and they specifically have different groups for small business executives and CEOs because they have different conversations, right? They're dealing with different things as they're evolving and as they're progressing through their career. And you've been through it all. You've been from that rookie playing basketball with those partners, surprised that you were even invited, right? All the way up to being a CEO, being CFO, being on the board of Fortune 500s. What was that experience like? I'm interested. I always, we hear about many people who serve on multiple boards.
Yeah.
What was the, I guess, the biggest benefit or the biggest takeaway that you took from that experience?
Well, again, I think of myself as I've spent my life as the young guy, right? I mean, I was part of the management leadership team, what they called the management board at Avnet. The first place I went after KPMG was a Fortune 100 company called Avnet. And about the top 10, top 12 executives at Avnet are on the management board. We run the business. We run the board meetings and are presenting business plans as well as past results and go forward plans. And I was 28, 29, 30 years old with a bunch of guys that were 60 and 70. You mentioned, we sometimes call our kids or think of our kids as stupid. And I'd put it a different way, not that you were being funny and I loved it. But I think of things in terms of two pieces. One is intelligence and one is wisdom. And I've got some really smart kids, but they're dumb as heck when it comes to having life experiences and thinking they understand the way the world works. And I was there. I was not knowledgeable of my lack of wisdom. I thought I was something pretty good. I liked myself a lot in my 20s. I'm not sure anybody else did, just simply because I lacked wisdom. And one of the greatest things about having mentors, I had this incredible mentor named Brian Hilton. He was the president of the $22 billion components division at Avnet. And I worked directly for Brian. Brian was the previous chief operating officer and senior vice president in charge of sales at Motorola, lifetime of experience. And he was my mentor kind of in that middle stage, those 10 years of my life when I was at Avnet. And I can tell you that you learn things not just about how to be a successful executive. I was managing teams. I was responsible for 2,500 employees in my time as a president. I was president of both the Avnet Asia. I actually started Avnet Asia, which is now a $13.8 billion portion of Avnet.
Interesting.
I acquired, because of my acquisition experience, I acquired the first 8 companies with Brian. But you don't realize what you don't know. It's very simple to know what you do know. But I think when you go in, I had to move my entire family to Singapore and Hong Kong to start up and be the first ever president of Avnet Asia. And I knew what I knew. I had no idea what I didn't know. I didn't understand that it was culturally acceptable for some of our purchasing agents to receive Christmas gifts like Rolex watches. And that's the way it's done. That's the way it's done. We were a Fortune 100 company. We couldn't stand for that. We basically had to change the rules, but it takes time. Culture and customs that have been around for hundreds, if not thousands of years in China, in Taiwan. That was the most interesting part of my process, was learning the cultural differences. Most Americans, we've got everything we need. I went into Singapore, Hong Kong, and China. Women were not acceptable as leaders, and we changed that. We changed that within our company, and some people left because they didn't like it, but that's the way it needs to be as you globalize as an organization. And secondly, we as an organization needed to understand we're not going to change customs overnight. But at the same time, we absolutely are going to be high integrity in everything we do and never bend the rules. And that was all a learning process for me, because I didn't know what I'd run into. When 28, I'm running a company of over 2,000 employees, and I did not know what I didn't know.
Isn't it interesting? You made 2 points that jumped out. You talk about the mentors you've had. I've had some extraordinary mentors. I consider you a mentor. I learned from you and our interactions in our business together. And reminds me of my younger brother, Adam. He was on my show 2 or 3 weeks ago as a CEO of a healthcare compliance company called HCP. But he worked for a company called Journal Technologies at one point. It's a Berkshire Hathaway company.
Sure.
And several times he was in a conference room with Charlie Munger, who's this billionaire, 90-year-old, plus year old billionaire, Warren Buffett's partner. And he said there were many times he was in the room with 3 or 4 90-year-olds, right? And just the experience he had listening at their feet, as it were. But at the same time, he also talked about how he helped them learn new things as well. You talk about going into Singapore and Hong Kong and how you had to learn the culture, but you also taught them things and you made changes. And isn't that the mark of a good, not just a good organization, but a good leader, is that you're willing to learn, but you're also a leader and a trendsetter. You're paving the way, if you will, for better practices and better methodologies, better mindsets. I mean, that's what I loved about Vistage, is I went in and I learned better practices from these other CEOs we associated with every month. So anyway, interesting.
Totally agree.
So I know you have a family home somewhere in California, up in Napa Valley or somewhere. We've talked about that. Do you still own the property there, or did you
Yeah, so
guys
it's
end up
actually
moving on?
it's a Pinot Noir and Chardonnay vineyard and winery. It's in Santa Barbara. It's called Clos Pepe Vineyards, and so we still have that property. I live down and that's in northern Santa Barbara County, sort of in between Los Olivos and Lompoc. Right on there's a highway that goes right there. And then my family lives down in Orange County, a place called Coto de Caza, California, John Wayne's old hunting lodge from 40, 50 years ago.
Really? Wow. I bet Frank loved that. You were on my business partner, Frank Hellring's show a while back. He's a huge John Wayne fan. He loves all the old movies, but
he's a great guy.
So, well, next time you're headed to your vineyard, if you need some company, let me know. I'm happy to come hang out with you.
Sounds like a good plan. Excuse me.
So as I said, Rob's here for 2 main reasons. One, because he has this just extensive background in business and finance and taking companies to the next level. His company now that he was highly recruited for, he's the CFO and a partner in CrossFire IQ. And they do a number of things. They offer a number of initiatives that can help benefit companies. You do tax credit recovery with the self-employed tax credit benefit for 1099s. Any 1099 out there can get up to $32,220 if they haven't already. It's waiting for them. I know you are highly successful in the merchant processing space. Your partner, Bill Hoffman, was on my show over a year and a half ago, and we talked a little bit about that at that time. But today,
we're now doing a lot of crypto credit card. A lot of people want to exchange credit cards for crypto,
is that right?
Or vice versa. And that's the fastest growing part of our business right now, is the crypto around the hemp and any of the industries that have a hard time banking and taking credit cards. Yeah,
I wasn't aware of that. So anyway, we're up against our first break, but when we come back, we're going to be talking about a third division of the company. I know you have multiple, but this is the division that's turning heads and creating a lot of buzz. We're involved with you as a vendor partner or an affiliate partner. But let's go to break real quick, and we'll be right back. We're visiting with Rob Hagen, the CFO of CrossFire IQ. Enjoying having you with us, Rob, but we'll be right back.
Great. Thank you.
All right, perfect, guys. All clear. Back in 2 minutes.
Thank you, Matt.
Awesome.
So like I said, a little bit of a stroll down memory lane.
Yeah, that was easy, and was a little bit fun.
Yeah, it's people always say, "Man, I haven't thought about that for 20 years." Right?
Yeah, no, it's funny going back and thinking about Tom Evan. I mean, I don't even know where he was 40. I mean, it was 35 years ago. He's now part of the. I mean, I still remember. I mean, he was building a $25-30 million home last time I talked to him, maybe 20 years ago. But just such a.
Wow.
That's kind of a fixer upper in the Bay Area, right?
Yeah.
It's Bay Area money is not real money. But yeah, he and his wife was the CFO of big tech company. So they both made a lot of money, and
they did well for themselves.
People, but they were always willing to give back. Not all people with a lot of money are jerks. They're real shining stars.
I've known some very wealthy people, and they're some of the kindest, most generous, most giving people that I've ever known. I mean, there's always the bad examples, and they're usually the ones in the tabloids or something like that. But
Right.
I believe the more wealth you create, the more good you can do. And there's a lot of people doing that.
Totally.
You're an example of that, Rob.
I appreciate it. My wife is very good at taking care of other people. I'm very good at making money. So between us, we're an excellent couple.
You're a good tag team. Now, did you meet in high school? You said you went to the same one.
We did not. We didn't meet until she's 9 years younger than me. So we were different. She likes to round it up, but it was just under 9 years. So
Gotcha.
yeah.
All right,
Yeah,
10
that would have
seconds,
been
guys.
frowned on. Thank you, Matt.
Did you say 10, 15 seconds?
10 seconds. Yeah.
Okay.
Here we go.
You're listening to Finding Certainty with Patrick Laing. Have a question for Patrick or his guests? Join us on the show at 866-472-5790. That's 866-472-5790. Now, back to the show with Patrick.
Welcome back to Finding Certainty. Having a rousing conversation with my good friend, Rob Hagen. He's the CFO of CrossFire IQ, which they do several things. I mean, officially, how many divisions do you say that CrossFire IQ manages for today?
6.
I know it could change tomorrow, but
We have 6.
all right. So at our company, Certainty Management, we have what we call our Magnificent Seven. We have 7 different divisions. They're all designed to help companies make more money, to help them make more and keep more. We encourage them to give more as well, as you know. But you've spent your entire career learning and growing and helping and developing this ability to take companies to the next level, and in the process, help them find more certainty, right? Help them develop greater confidence and greater capacity and capability than they had the day before or the year before. And I really believe that the Vital 110 program can help employers accomplish that. Do you mind just giving a quick 10,000-foot view of what it is? Or I can, and then you can comment, whichever you prefer, Rob.
So I'm happy to do it, and you can fill in or ask any questions. So
Sounds good.
Vital 110 is a group health plan, a group insurance plan with no cost and no copays for the employees, tremendous benefits, which we'll talk about, as well as some tremendous benefits for the employer. There's 3 benefits for the employer, including additional profitability for the employer, that all comes about through tax breaks in the way that the plan is organized. So what we'll talk about is the current method of providing healthcare is very, very inefficient. You go see your doctor, you go to a hospital, you go to an urgent care for just about anything. And what COVID did is it created an understanding that many things can be done virtually over a Zoom call. Much easier to get in touch with a specialist doctor that will meet the needs and understand you and your needs for medical care, and in a very cost-effective methodology that, again, because of the tax breaks that are available for group health plans, can be done at no cost to the employee with tremendous benefits, whether they've got a big group health plan or they're uninsured or underinsured. Again, great benefits for both groups.
Right. And it's not just wellness, right? It's not just preventive, although that's a very big piece of this, and we'll talk about that, but it's telemedicine, it's telecounseling, right? I've even heard of programs that have televet, right? They can look at your pet over
Right.
a virtual appointment, whether you're talking to a primary care physician or a specialist or a licensed psychiatrist or counselor. I find myself now, and I was using Zoom years before a lot of people were. I used to invite people to a Zoom call, and they thought, "What is that? That television show that used to be on,
Right, get on an
TV?"
airplane.
But now I have people who want to meet for coffee, and I say, can we just meet over Zoom? Because it saves me a 3-hour block of driving
Right.
over there, meeting and driving back, when I can do it in 30 minutes,
Right.
still accomplish just as much. I mean, once in a while I'll get together for lunch with somebody, but I really prefer to do it just from an efficiency standpoint, right? So
Doctors feel the same way.
yeah, I'm going down a rabbit hole there, but so go ahead. So you have these free benefits are zero cost to the employer, zero cost to the employee. I mean, that of course caught our attention. Who doesn't want something at no out-of-pocket cost or zero cost, if in fact it's of quality, right? If in fact it's valuable, but let's get into a little bit more of what some of the other benefits are. You know, the free telemedicine, free telecounseling. What else is included in those benefits?
Yeah, so like I said, I mean, in order to make this IRS compliant, the developers of the program with us have built it all on what they refer to as a MEC, or minimum essential coverage plan. So it qualifies as a group health plan for the employer, which has huge tax advantages. With that MEC plan comes a lot of physical, not over Zoom, but physical preventative health benefits like mammograms, colonoscopies, all the children's vaccines or adults vaccines, and a lot more.
Annual exams, labs, things like that, right? Right.
Yeah, so they've got an exclusive relationship with Quest Labs, one of the largest, blood and other testing facility. They've got over 5,600 facilities. All of your labs, all your tests that your doctor or teledoctor is going to assign, blood tests, urine tests, all that's 100% coverage, no copay,
wow.
no cost.
Amazing.
I'm a type 1 diabetic. When I go and get my 4 times a year, it costs me $180 at Quest. It's now zero. It's
Incredible.
now zero, which is a huge benefit. Telecounseling, you said, there's family counselors, financial counselors, drug, alcohol, and smoking cessation counselors. Whatever you're dealing with in your emotional health, they've got access to licensed clinicians that will get in and help anyone in your family. All these benefits are available not just to the employee, but to the spouse and the children under the age of 26. There's also
Can I interject real quick, Rob?
Sure.
I want to emphasize here, guys, that these are programs that don't require a copay, right? And if you don't have to pay a copay, you're much more likely to use it. I heard a story of a client that she was having stomach issues. She was just going to go to sleep because it was really bothering her and it kind of exhausted her. But her husband said, we have that program. Let's just call up let's just call this teledoc. It doesn't cost us anything. Let's call a doc. The doctor, when he heard what her symptoms were, said, you need to call 911, keep me on the phone. I want you to hand it to them when they get there. And it turned out she had an obstructed intestine. He said she would have died that night if she hadn't gone to the ER. And this program, at least, or a program like it, was able to, because there's no copay, right? There's no barrier to entry.
No reason not to.
The couple used it and saved her life. And I experienced the same thing last year. If you'll remember, I had my appendix out. I called the doctor, was having stomach issues. Frank, my business partner, forced me to. We were on a business trip in Arkansas, of all places. And I called the doctor. He said, you need to get to the ER, and had my appendix out before they burst about 3 hours later. So
yeah, it's a big deal. We had a client that just went live, and he was spending 2 days a week in marital counseling, which ended up saving the marriage and just made a huge world of difference in the relationship in the home. But before they went live on the program, they were spending $4,400 a year in copays based on their group health. Nothing in terms of paying the full premium of the counselor. They were getting medical coverage on all their counseling sessions, but they were still paying a $35 copay each of them on their weekly visit, and they ended up saving $4,400 and didn't need to change counselors. The counselor was still in the program.
Wow.
And they kept and saved $4,400, which for them was a significant savings.
That's incredible. I know there's also features, and correct me if I'm wrong, because you've you've recently upgraded the features. He's even more available today, but does it still include things like a licensed dietitian or
It
remote
does. That's all the
fitness
virtual counseling.
coach, things like that?
Yeah, yeah. The exercise coaches, licensed dietitians. A lot of times the health scan will come back. The app is on a smartphone, and it can take all kinds of measurements. This thing has so much intellectual property around it. Can get your blood pressure. We saved a heart attack. They were measuring their blood pressure on a daily basis. The doctor saw that the blood pressure had gone from about 120 up into about the 190, and immediately had them go to the hospital. Was ready to have a heart attack, and prevented the heart attack, and there was no permanent damage. So there's lots of neat applications. You name the opportunity to use artificial intelligence in the app, as well as the benefits that are available. And then there's also some physical. I mentioned a lot of the preventative stuff, mammograms, colonoscopies, physical body scans, and all the rest. But there's also, we pay for the first 3 times that you or your spouse wants to go to an urgent care, a physical urgent care. There's probably 16,000 urgent cares across the country that are part of the program. And if you need to go and see somebody or be bandaged up, no cost, no copay. You can go 3 times to a physical urgent care. So it's not just virtual urgent care.
Remarkable. Now, is that the employee and the spouse
Employee
have
and the
that
spouse.
access?
The physical does not. That's the only program that doesn't apply to the kids under 26. All these other benefits will apply to the whole family.
Or for the whole household, right?
The whole household. That's right.
Yeah. So it's important, if you're listening to this, to understand, why are they doing this, right? Why is this program available? And if there's any other benefits you want to mention, Rob, please interject.
Yeah,
but
the big one, the biggest upgrade, and I want to mention this quickly, is one of the biggest costs of the health plan, and the biggest cost for employees, is pharmaceuticals. You need to have prescriptions, regardless of what you need. And this plan, it comes with a product called Pivot RX. And Pivot RX supplies the 1,200 most prescribed generic pharmaceuticals at no cost. So, maybe your group medical plan will cover some of these costs at $20, $30, $40 per prescription. This provides those 1,200 medications, no cost. Pretty
amazing.
neat. That's a pretty neat benefit in addition. Yeah.
When we were first introduced to this, Rob, I honestly thought it sounds too good to be true.
I hear that a lot.
It sounds like thousands and thousands of dollars of value in a year, especially if you use it.
That's right.
And it's zero cost to the employee and to the employer. In fact, the employers are rewarded financially in several ways for incorporating this into their business. Now, they have to have at least 10 W-2 employees, is my understanding.
It's actually 3. We prefer 10 or more. We don't make enough to make it worth our time. But if we've got a good client that we really like, 3 or more W-2 employees is the minimum, again, required by the plan documents.
That's the friends or family deal, right?
That's right. That's exactly right. Only for you, Patrick.
So so back to my question, why are they doing this? Well, and let me tell you my understanding, correct me if I'm wrong, but the way we understand this is that Congress knows, whether you're Republican or Democrat, both houses, whoever's in the White House, doesn't matter. They know that we have to do something to help Americans get more healthy. We have rampant, accelerated cases of heart attack, cancer, stroke, diabetes, etc. And so this is actually a bipartisan program. It's been around for about 15 years now, all part of the Affordable Care Act, Section 125, cafeteria plans, as they're called. But it's designed to help our employees get more healthy. If we can head things off early, head them off at the pass, as they say, we can reduce the levels of disease in the future. And of course, all comes down to money, right, when it comes to Congress, and hopefully lower the costs of Medicare. Is that a pretty good synopsis, or did I miss anything?
No, there's a tax law in 1948 that makes the expense reimbursements back to the employee, pre-tax. The whole idea of premiums for those policies, as well as the expense reimbursements staying pre-tax, is part of a 1948 tax law. You add to that the MEC plan qualifying as a group health insurance plan in the Obamacare Act or the American Care Act. And then, the Section 125, which this is a Section 125. If the employer already has a Section 125, we simply have an addendum that adds this program to the existing Section 125 plan. If they don't, we create a Section 125 plan, and our TPA or third-party administrator does all the administration, does all the tax filings, everything that needs to take place to keep this plan solid and tax compliant is all done by the third-party administrator, which is a company called Health Compass.
Remarkable. That's another thing that a question I guess we had when we were first introduced to this is, it sounds like a lot of work. It sounds like I'm having to track my employees and so forth. And really the only thing the employer has to do, though, is submit the payroll information initially so I can go through underwriting and get set up. And then if anything changes within their team members, their staff, if they terminate someone, if they hire someone, you just need to update the underwriter. Obviously, they want to make sure they're covering the right people and not covering people who aren't there anymore. To that point, now, is there any other insurance? Is there a life insurance included in this?
There is. Well, I'll answer the first question second, and vice versa. So the third thing, once the plan is set, there's really only one thing that the third-party administrator needs on a monthly basis. It takes 5 or 10 minutes, depending on the number of your employees you have. And it's exactly the same as what you would do for a group health plan or a group dental plan, which is, did anybody retire or come off of payroll? They need to know that so that there's no billing for the cost of the program. And then, has anyone qualified for the program, which just simply means they have $25,000 or more of annual income. They're paid using W-2 earnings, and they've been working for the company for 30 or more days. Those people will qualify to be added to the plan as well. So It takes 5 or 10 minutes. You cut and paste what you did for your group medical plan. You do it for this so that the right people are on the plan, and anybody that belongs off the plan is off. The second question is, we didn't talk at all about the life insurance policy. There is a very generous whole life insurance policy. Whole life insurance policy simply means there's two parts. There's a death benefit. A lot of employers will offer $5,000 or $10,000, maybe $15,000 of a death benefit insurance policy. This is not that. This one actually comes with $100,000 or more of a death benefit on the employee, which for a lot of people makes a huge difference. It's
100%.
fully portable. It's fully portable, and it's also the first $100,000 of coverage is guaranteed issue. I said before, I'm a type 1 diabetic. I have a lot of positives about my life. I love my life, but we are not easy to insure. Again, I got $100,000 of guaranteed life insurance with the whole life insurance policy. The other two are HIV positive and cancer. So if you struggle, or you have employees that struggle with those 3 diseases, they're going to get a significant life insurance policy, again, without changing the paycheck at all of the employee, and without costing the employer any out-of-pocket costs after the tax savings are paying for the program. Okay.
You talked about it being mobile. We are up against our next and last break. When we come back, let's talk about that. I want to talk about what happens with the benefits if an employee leaves.
Okay.
Because that plays into the whole question, which is so important to employers of recruiting and retention, right? But don't go away. We'll be right back, me and Rob, in just a minute.
All right, perfect. Good job, guys. I'll clear back in 2.
Thanks,
Great.
Matt. You're doing great, Rob.
Good. Like I said, it's not a hard program to talk about. There's no, we're not looking for a check.
That's the most extraordinary part in my mind. We need to get into the finances of it. So I always say on the YouTube, people get the behind the scenes. So we're still recording. So if you have a good joke or something nobody knows about you that you want to share on YouTube, now's the time.
Yeah, well, I don't I'm a lot of things. I'm not a stand-up comedian, so yeah, and anything I've got is so inappropriate that I certainly I'm
You'll
on
defer.
I'm on council, which is the board of our church, and I'm sure I'll have some of those other board members and our lead pastor come on and take a listen. And yeah, I don't need to tell any jokes that are going to get me in trouble.
My wife's favorite joke is, what do you get when you cross an elephant and a rhinoceros? She loves this. She'll just wait. She says, what did you get? And she tells everybody this joke. This is her one joke, right? She says, Elefino.
That's pretty funny. That's pretty funny.
That's a pretty good one. You can tell that one at church, probably.
Yeah, I could probably get away with that. Yeah. So
it's not too off color. Yeah.
No, it's actually it's totally fine for the kids, and that's good. Pretty good. Good call. Good decision.
Her other joke is, whenever somebody says something, she'll say, well, it's all relative, and it depends on who your relatives are.
All right, guys, coming back.
All right, thanks, Matt. We're coming back.
Okay, that's good.
You're listening to Finding Certainty with Patrick Laing. Have a question for Patrick or his guests? Join us on the show at 866-472-5790. That's 866-472-5790. Now, back to the show with Patrick.
Welcome back to Finding Certainty. I knew you'd do a good job, Rob, but you're knocking it out of the park. You're a perfect guest. I have guests who talk and never take a breath, and others who are very monotone, and others who are, just all about them. And not too many. I've had great guests, don't take me wrong, but you're a consummate interviewee. So, okay, moving on though. We were talking about the benefits to the employees from telemedicine to teledoc or telecounseling and all the different preventative measures like annual exams and labs and mammograms and immunization. The list goes on and on, right? You can even go see a doctor in person 3 times a year. And then on top of that, you get a life policy. Does it also have some living benefit aspects to it, or is it strictly a term policy?
No, it's a whole life insurance policy. It's a whole life insurance policy. It's a group whole life insurance policy that is portable. And it also comes with a cash value element. So there will be deposits being made into the cash value, as is typical with any life insurance policy with a cash value. The first year or two, there's not a lot of growth in the cash value. It's going to pay for the policy. But after that initial 12 to 18 months, the cash value grows quite nicely with continuous deposits every payroll. And because it's underwritten by Mass Mutual, Prudential, one of the big 5 insurance companies, it grows very effectively, plus has tremendous downside protection because companies like Mass Mutual know how to hedge an instrument like that, which really helps a lot.
Yeah, they'll use an indexed fund or something like that where it can only go up. It's not going to drop below a certain level.
That's right.
Now, is there a living benefit aspect to it? I wasn't sure where if someone does get a serious disease, they can draw from that policy as well, or is it strictly the death benefit?
You can, starting in month 13 with most of our insurance companies, where you have access to the cash, and that cash is the employees to keep. So if they ever were to go somewhere, or they were to retire and they've got $25,000, $30,000, $35,000 of cash value, they can take it with them. They'll typically roll it into an IRA to keep it tax deferred and tax advantaged.
Well, you've mentioned the word portable a couple of times, where they can take it with them. They would, of course, start paying for it themselves, where
that's right.
Initially, because of how Vital 110 is set up, it's being paid for by the program, by the tax credits that are created. Now let's talk about the employer here. We're going to run out of time soon. It's a really important piece of it. We
It is.
introduced this entire interview talking about how you help take companies to the next level. That's what you've done your entire career. And this program can help do that. I
It really
love the
can.
fact, that I can bring this to an employer, say this costs you nothing, costs your employees nothing, does not affect their net income. And you're not only have to pay, you don't have to pay anything yourself as the employer, but you're going to get paid as a FICA tax credit or as a business tax credit every year in perpetuity for as long as you stay on the program. That's extraordinary. I mean, I've never heard of anything like it, Rob.
Let me spend 60 seconds talking about the employer benefits real fast, because a lot of employers are going to want to hear this. First off, there are no tax credits. This program has no tax credits associated. It's all based on tax savings. There are assigned reimbursed costs that are coming through. It's about $800 for a single individual. Families get $1,125, and those amounts create tax savings, primarily FICA tax savings, because that's on the employer side. On the employee side, there'll both be FICA tax savings as well as state and federal income tax and local taxes as well. There's tremendous tax savings by putting a medical plan and then getting all of that money back through the reimbursement of the usage of the program. So again, the employee is not out any money. If their paycheck starts at $3,500 a month after taxes, they're going to still, that same paycheck is going to be $3,500 after taxes or more. So no employee that's a part of this program will ever see a reduction in their take-home income. Huge advantage.
Right. You said earlier too, let me just interject, Rob. You said earlier it's for W-2 employees. It's not 1099.
Correct.
If you are a 1099 looking for some benefits coverage, reach out to us. We can help you. There are other ways we can do so. But this is specifically for W-2.
That's right. It's for W-2. So the tax savings are bigger than the costs of the program. So the total tax savings that are created by the program for the employer and the employee is higher than what the program costs. And so that difference represents additional tax savings or additional profitability that will fall to the bottom line. You talk about helping employers, particularly in financial times like this. On average, it's about $500 per employee that you bring into the program. That'll net be additional cash that the employer will be able to keep. So if I just did one yesterday. We just had a closing call yesterday of an employer that was taking 2,000 employees into the program that had already gone through the education, the onboarding. 2,000 employees is $1 million a year of additional cash that the employer gets to keep. Privately held company.
And that's
$1 million of additional cash, additional value, direct to their bottom line. It shows up on their P&L as a reduction in employer payroll taxes paid. So that's a big bonus. But I want to talk about, we already talked about the retention. Employees don't want to lose the life insurance policy. They don't want to lose all these benefits for them and their families and their spouse. So employees do not leave as act. We've seen 20 to 40% reduction in turnover. But the third one is one that people don't think about. And that is, let's just say an employer offers group health insurance and then they supplement with this Vital 110 product line. What happens when that happens? And this is why the government likes it so much, is that instead of doing the telemedicine appointment with the group health insurance, that one has a $20 copay. This one doesn't have a copay. So, spouses and the employee and the kids use Vital 110. If they need to get, the test done, I've got a blood scan I need to do at Quest Health. That cost is about $1,200, and before it was paid by group health insurance. That shifts to Vital 110 again because there's no copay. So we see 20 to 40% of the costs that go to United Health, Aetna, Blue Shield, Blue Cross. All of a sudden, the utilization of that group health plan comes down. And now your insurance broker loves this because they can go back and take your group health plan to market and they can see 15, 20, 25%. We all see as employers, we all see 6 to 12% increases year after year after year. And that is a big cost driver for most companies.
Oh, yeah.
And for the first time ever, they actually get a benefit because the costs of Aetna or Blue Shield, Blue Cross to cover you as an employer have come down because there's a much more efficient, tax efficient, and expense efficient way to do healthcare. And because of that, you're going to see lower costs. The employer with 2,000 employees, he saw $1 million benefit to his bottom line with lower taxes, but he also saw a $2 million incremental benefit when he took his medical plan out to market to get the lower premiums. So that's a pretty significant deal.
Yeah, even more savings from the healthcare reduction, or being able to renegotiate better pricing. So just to recap, the top 3 benefits to the employer are an immediate benefit through the tax savings, direct to their bottom line, about $500 on average
per employee, pro rata. You get a pro rata amount each payroll period.
Right. So per employee per year,
and that's not 1 year. That's
in perpetuity.
As long as you're in the plan. That's right.
Secondly, we keep saying recruiting and retention. Manpower is a real problem these days. There are employers all over the country desperately looking for more employees, and once they get them, looking for any way they can to keep them. There's enormous turnover, right? If you can reduce your turnover by 20 to 40%.
Restaurants, hotels, hotels, retail, anywhere where you're fighting for those employees under $50,000 to $75,000, depending on where you live. This is a great retention. I can't tell you what an impact it's had on so many of our clients.
Well, and a lot of those customers out there, they aren't currently offering benefits, right? If they're less than 50, if they're above 50, they have to have a plan, or the MEC penalties come in, the minimum essential coverage penalties kick in. But there's so many out there who do have W-2 employees, but they're not offering healthcare. Right. And this we always say some coverage is better than no coverage, right? This can cover most of the reasons someone is going to a medical professional. Of course, it's not true insurance. It's not going to cover you if you get cancer or if you get in a major car accident. You need a catastrophic plan, or you need something like that. We can help with that too. If you need it, we have a program that's 30 to 70% less than traditional insurance. I don't know if you knew this, but Rob, I dropped my family's insurance cost with Impact from $1,500 a month to about $460 a month. And then we can go to any doctor, any hospital. So if you need that, let us know, because we can help with that. But these 3 benefits, and then you add the fact that because your employees are getting more healthy, they're utilizing the service. Not only are your costs coming down, but they're hedging off future problems. It can not only be very expensive, but devastating. So we're almost out of time here. We got about 3 minutes left. What did we miss? Anything else you want to add to this before we end this, Rob?
I'll throw out a funny story to cover one more benefit that I didn't mention, and then maybe I'll answer one question I get all day long. So one of the benefits is a health concierge, which will help you find specialists, will help you handle billing difficulties. We had a client that had an employee, young kid, probably 24, 25 years old, male, and he was watching the football, the Super Bowl, just a month ago. And he decided it was a good idea to have 35 super hot and spicy buffalo chicken wings, which God knows we all have too many chicken wings, right? And his chest started to hurt. Well, he was experiencing heartburn, but he had no idea it was heartburn. So he went to the hospital and said, I think I'm having a heart attack. So, the hospital started going through all the tests, and they discovered that it was heartburn from all these chicken wings. And because the codes drive the billing, he got an invoice from the emergency room for $22,000 because they had used the codes to bill him for a heart attack, treating a heart attack in the emergency room. So he called the 1-800 number, asked for the health concierge. The health concierge says, no problem, I'll get that fixed for you. Went back and dealt with the insurance companies, dealt with the hospital, dealt with the doctors, every single one of them. The $22,000 invoice became $220, which was his all-in cost for going to the emergency room to deal with heartburn that he didn't even know he just needed an antacid to solve. But again, another really nice benefit. The last thing you ever want to do is to have to go back and renegotiate with a hospital or set of doctors, because that's no fun, and a lot of us just aren't very good at it.
Right. And if you're going to, you better have a professional who knows what they're doing, who can help you. So they even helped him with his traditional health plan concern.
That's right.
That's amazing.
All
right. One more minute. What do you want to leave us with?
I'll tell you that. So one of the big questions we get quite often is, you've been working for private equity funds, you've been doing all this stuff, you're not doing this for free. How do you get paid? How does our company get paid? And the answer is, it is illegal for us to touch. We do not touch the tax savings. That is for the employer and the program, and that's the way it works. We get a small piece of the commissions. As you can imagine, there's medical, there's health plan commissions, as well as the life insurance policy. So that's the way we take a small piece of the commissions on those, and that's how we get paid. That's one of the most commonly asked questions. Like, I don't understand why you're bringing me all this gift, and we care about people. I much prefer doing this for a living, but we're not doing this for free. But at the same time, you as the client or the business is not having to pay for us bringing you this program. Okay.
Well, that's the best answer to the sounds too good to be true question, right? Well, Rob, we really appreciate you being on Finding Certainty. I think this is definitely one way that employers, anyone with W-2 employees, at least 10 or even 3, if it's on a case-by-case basis, if you are looking for ways to help add to those benefits and help recruit more, help retain more, help improve the satisfaction, the life satisfaction, employee satisfaction of your team, most definitely reach out to us. We've got the contact information in the description below. Rob, thanks for being here. Have a great weekend, man. Really appreciate you being on and sharing a little bit about this extraordinary program.
Looks like our Southern California rain is turning into sunshine, so I think we might be outside.
There you go. All right, guys, have a great weekend. Thanks for being here with us.
Thank you, everybody. Thank you, Patrick.
All right, terrific job, guys. Good show. We're clear.
Thank you, Matt.
You're welcome. Thank you.
All right, Rob, we're still recording. If there's anything more you want to add to the YouTube piece of this, if not, I think we covered pretty much all of it.
I think we covered it. I think we covered it pretty well. I appreciate you letting us do this. It's a great program, and we obviously have some of the best agents in our agency out talking to people, but you can't get to everybody, right?
No, it's the type of program that most people, when they hear it, there are those skeptics who won't look at anything, but most people, when they see this, they say, well, where do I sign up? Right? It's a absolute no-brainer. I would probably just add to this, anyone who's watching, if you're looking for an extraordinary sales opportunity, again, Rob, you just mentioned, it's just getting the word out to as many people as possible that this exists. We don't foresee it going away anytime soon. I mean, it's been around for a long time. This is not a new program. It's been proven. It's been defended. It's gone through multiple White Houses on both sides of the fence, right? But it is an extraordinary opportunity to go out and not just make a remarkable income. The commissions on it and our share in it is very generous, but really a chance to not just do some business, but do some good, right? Not just make income, but make a difference, as we always say. And that's, I think, the piece I'm most excited about. We're very honored to be a part of it and very encouraged by what we see, very impressed so far by what we've seen. So it's going to be an amazing next few years as we share this with billions of customers all over the country.
We would deal with hundreds of millions, but if it turns into billions, then I mean, given this is a U.S., obviously U.S. plus all 5 inhabited US territories, and we've got 330 or 350 million US. So if we get to billions, we've got some tax problems.
That's
But
right.
a couple 100 million would be just fine.
If you need help with your tax problems, see us. We've got some amazing tax strategies. Sorry to keep making plugs, but it's all about getting the word out, right, of what we
Amen.
do. It's one of the reasons
Amen.
I do this show, to have a platform to spread the word of what's available. There's so many amazing programs that
There really
people,
are.
and I hear this often, Rob. I mean, I know you do too. People, I mean, how often in a day to someone say, why haven't I heard about this yet?
Right.
Right?
No, there's,
Because
as you know, there's 1,100 federal tax credits that are available to businesses, small, mostly small businesses. And, you see, Microsoft and Intel and these giant tech behemoths that are making billions and billions of dollars, and you see their taxable income and it's like $100. You're like, well, how do you do that? And how do you do that legally? And federal tax credits, state tax credits are a big reason why. And it's not that small businesses don't have all the advantages of moving fast and growing fast, but they just don't know about the tax strategy. It's not what you keep, it's not what you make, it's what you keep. And seeing some of these creative but completely legal ways of keeping more of your pre-tax income is a big part of the strategy that you guys sell, and we certainly talk to people about all the time.
Well, we mentioned at the very beginning how CrossFire also does the self-employed tax credit. That's another good example. There are millions of 1099 independent contractors out there
16 million of them.
And they killed themselves through the pandemic just to survive, just to keep their families fed. And they survived. They made it. Some of them didn't. Some of them went out of business or whatever the case might be. But they don't even know that this is available.
They don't.
And then they also have accountants and other tax professionals who tell them, well, you don't qualify for that. And they don't know the tax code. They're not tax recovery experts. They've read the first page of a Google website or something, the IRS website, and there's hundreds of pages of legislation and documentation and so forth. And so it's another good example of a program that people just need to be educated on. That's why I say, if you're looking for an opportunity, reach out to us, because our team is growing rapidly. And how often do you get an opportunity to share something with a business at zero cost to them? You do not ever have to ask for a check. It's going to transform their lives. And the commission side of it, the earnings side of it, is a significant 6-digit and plus income if you actually do something with it. And so we're very excited about it, Rob. We really, really appreciate all you do for our team and our customers. And
you guys are great.
The future
really
is bright.
Future is very bright. All right, man. Have a great rest of your day.
Thanks for giving me some of your time. Really appreciate it. Have a great weekend. Don't forget that vineyard trip. One of these days we got to meet, especially if there's any fishing in their area. I'm a big fisherman, but
I'd like that. That could be a lot of fun. Let's talk about it.
All right, my friend. Take care.
All right, take care. Bye-bye.
Thanks a lot, bud. Bye-bye.
You too. Bye.
Well, I don't normally make that many plugs for what we do. I think they're applicable. We do the self-employed tax credit that can get you up to $32,220 if you were 1099. We do this corporate benefits initiative that we've been talking about, Vital 110. That can help anyone with at least 10 W-2s. Today was the first I heard that they'll make an exception on that, I guess on a limited basis. But if you're looking for benefits, if you're looking for lower cost medical coverage, true major medical coverage, not just the health and wellness benefits and the preventative benefits, but true major medical. My personal insurance went down from $650 a month to $150 a month, and I can go to any doctor or hospital. Here I mentioned during the show our 7 divisions, what we call our Magnificent 7. It's a nod to the old Western where they came to the rescue and helped the town that was in trouble. That's what we do. We come to the rescue of our customers. We help create more certainty for them. We do that in their banking, their benefits. We do it through cost reduction, what we call no downside cost reduction, because most cost reduction comes at a cost. You have to cut out payroll, programs, and people. With us, you don't. This is a way that we can reduce costs and drive more dollars to your bottom line through renegotiating a contract or providing free benefits or recovering tax credits and so forth. We can help with your energy costs, especially if you're a large commercial entity, a property manager, a public venue, a city, something like that. We are a lender. If you are a business in need of funding, let us know. We can get you business capital, lines of credit, equipment financing, and so forth, and do so in a matter of days versus weeks or even months, as you'll find with most of the banks. We work in imaging technology. These are your printer and copier contracts. This is a very expensive space, multi-billion-dollar industry with unregulated, it's an unregulated industry, no checks or balances. We can come in and cut most contracts in half. Literally, we average 32% even after our share of the savings. We also work with a number of different recovery methods, whether it's tax credit recoveries, medical underpayment recovery. This is with hospitals and surgical centers where they've already been paid on accounts. We can go and audit those accounts and recover on average another 21%. The list goes on, but it's all designed to help you be more profitable. And we do a full analysis of a customer's situation. We look at where can we make incremental changes. Some of the changes we can make are significant, 20, 30, 40% savings, even more, if you can imagine. When you combine all of that together, it can literally revolutionize your bottom line. That's what we do through our Certainty Collective, as we call it, Certainty Management, our consulting firm, Certainty Global, our technology joint venture firm, Certainty Holdings. We would be honored to speak with you. I don't do a pitch like this or a plug for us very often on these videos, but because of the nature of today's call, I thought it's worth reminding you of some of the things we do. If you'd like to learn more, go to certaintyteam.com. You can call us at 888-684-3122. Reach out to us today. Let us know how we can be of assistance. I wish you the very best. Thanks for being on Finding Certainty with us. And we look forward to speaking with you soon. Hopefully we can meet soon. Take care of yourself. And bye for now.